Figo staging of cervical cancer is very important and it is absolutely necessary for us to memorize it, especially for those in final year MBBS and postgraduates. So let's begin. Similar to endometrial staging, we have 4 stages here: stage 1, 2, 3, and 4. There are many subcategories under these 4 stages. For stage 1, we have 1A and 1B. Stage 2A, 2B. In stage 3, we have 3A, 3B, and 3C. In stage 4, it is similar to any other gynecological malignancy. It is 4A and 4B. So 2A and 3A are similar. 2B and 3B are similar, which I'll be dealing together. In 1A, again it is divided into A1 and A2. B is divided into B1, B2, and B3. 2A is divided into 2A1 and 2A2. Don't worry about the numbers. The subcategories are based on the dimensions. In stage 1, the tumor is confined to cervix. So in 1A, there is only microscopic invasion. As such, the tumor is not visible, but however, in any cone excision biopsy or something, we find that there are cancerous cells. So in A1, the depth of invasion of the cervical stroma is less than 3 mm. In A2, it is 3 to 5 mm. So stage 1A is only microscopic. From 1B, there is visible lesion, and the depth of invasion in B1 and B2 are more than 5 mm. And depending on the size of the tumor, it is again divided into B1, B2, B3. So the size is cervix and vagina. It is less than 2 centimeters, 2 to 4 centimeters, more than or equal to 4 centimeters. So if there is a tumor in the cervix which is of size 4 centimeters and it is confined to cervix without invasion into uterus or vagina, it is B3. Then coming to 2A, again we have 2A1 and 2A2. So in stage 2, there is minimum extension around the cervix. So what are the organs close to the cervix? The tumor can either extend to uterus or into the upper 2/3 of vagina. So it can either invade into the uterus or into the upper 2/3 of vagina. Then it is stage 2A. So depending on the size, it is either less than 4 centimeters or if it is more than 4 centimeters. Then coming to 2B, here the tumor goes slightly beyond uterus and vagina, so it will be involving the parametrium. But however, it is not reaching the pelvic walls yet. 3A, I have told that it is similar to 2A. So in 2A, there is invasion of upper 2/3 of vagina. In 3A, there is invasion of lower 2/3 of vagina. In 3B is similar to 2B. So here there is parametrial involvement. Here it will extend up to the pelvic walls, pelvic side walls. So you know that ureters also pass along this way. So if they block the ureter and they cause hydronephrosis. And it may even result in kidney failure. So presence of hydronephrosis is stage 3B. Coming to 3C, it is similar to endometrial staging. C is for lymph nodes. C, if you round it off, just like O, so it is lymph nodes. C1 and C2. C2 is presence of local lymph nodes, that is involvement of pelvic lymph nodes. C2 is involvement of para-aortic. Coming to stage 4A, it is invasion of adjacent structures. So the structures adjacent anterior to it are bladder and posterior to it are rectum. So involvement of bladder and rectum is stage 4A. And involvement of distant organs like liver, lungs, and any extra abdominal lymph nodes is stage 4B. So let's see the theory part. In stage 1, the cancer has spread from cervix into the deeper tissues. So 1A is only seen microscopically and it is less than 3 mm is 1A1, 3 to 5 mm is 1A2. 1B1 is less than 2 centimeters, 1B2 is 2 to 4 centimeters, 1B3 is 4 centimeters or more. Right. And the depth is 5 mm, is more than 5 mm. But however, the dimensions are as less than 2 to 4 and more than 4. Coming to stage 2, it will invade just beyond the uterus into the adjacent structures, that is uterus and vagina. In 2A, it involves the upper two-thirds of vagina, and in 2B, there is involvement of parametry. In stage 3, again we have 3A, 3B and 3C. 3A is invasion into lower third of vagina. 3B is growth reaching up to pelvic wall and also affecting the kidney. In 3C, the involvement of pelvic nodes and para-aortic nodes. And in stage 4, there are 4A and 4B. 4A is involvement of bladder and rectum. 4B is involvement of other parts of the body, it is distant meds.